So this morning class, we will be talking about the next section of your paper, and that is the research methodology. So, di ba sabi ko, after having the research title, the final research title, you should be doing the introduction, and then after the introduction will be the research methodology. So this morning, we will discuss and describe the classifications and types of our research designs, which are commonly used in health-related researches. And then we will also discuss concepts and structure of the most common study design, including experimental, quasi-experimental, observational, qualitative, and mixed method design. So we will discuss their concepts and their structures. Now, please take note. Wait lang. Sorry. Okay, please take note of the different subsections of the methodology. Okay, starting with the research designs. Kagaya ito ng introduction class na after the introduction, you have the statement of the problem, the hypothesis, significance of the study. Those are the subsections. This time for the methodology, may subsections din. Again, it will start with the research design, followed by the research local, and then the population and the sample, and then the other parts will follow, like the research protocol, the ethical considerations, and statistical treatment. So what do you mean by research design? It's like our overall plan on how we are going to complete our study, or how are we going to gather our data. So in this section, it's not just about identifying our plan or our research design, but we will also discuss it, explain it, and elaborate how your rationale. You have to elaborate your rationale why you have chosen this method in gathering your data for your research. So let us discuss them one by one. Our research design is classified into 4. The first one is classification of research design based on time. Okay, again, it's based on time. We only have 2 research designs under here, yung based on time. We have retrospective and prospective design. Now, let's start with the retrospective. When you say retrospective, we are studying actually the past. Okay, retro means the past. We are going back to the past class. So, our study will begin at the present, and then let's go back to the past, and then the study will end also in the present. So we have an example here, association between the use of this substance, phenylpropanolamine, and the risk of hemorrhagic stroke. So we may look into how we're going to do this research design. For this study, we will look into people na merong hemorrhagic stroke or naka-experience ng hemorrhagic stroke. And then let's go back to the past, whether they have exposure or they are constantly using this chemical substance or this drug, the phenylpropanolamine. So again, retrospective siya. Babalik tayo sa nakaraan. Diba? That is based on time. Now, the perspective is the other way around. Our study will begin at the present, but it will progress forward and end in the future. Okay? So we will look into the future of what will happen to the phenomenon or the situation that we are investigating. So we have here an example of a prospective design. The investigators were interested to determine the long-term effectiveness of our influenza vaccines in elderly people. So the design of this study is they are going to recruit cohorts or yung mga samples or yung subjects of the study, and then they will be grouped into the vaccinated and the unvaccinated. And then, syempre, the study will start in the present, no? So, babakunahan yung isang grupo, yung isa hindi. And then, we will move forward to the future and see gaano katagal yung protection na mabibigay ng pinag-aaralan na vaccine. Okay? So, that is retrospective and prospective. This is based on time. The other one is studying the past, what happened in the past, and the prospective design will study what will happen in the future. So if you're going to evaluate your concept paper, kasi wala pa kayong final study, you evaluate it whether your study is a retrospective study or a prospective study or design. Okay? Now, number 2 classification is called classification based on study purpose. Okay, what's our purpose for conducting the study? We will classify them. The first one is the descriptive design. From the name itself, descriptive, our purpose is to just simply give a description of our subject or our population. In terms of the variables that we are looking into. Okay? Pwedeng sa kanilang behavior. We will describe their behavior, their attitude, their practices, or whatever. Kung ano yung pinag-aaralan natin. Even perceptions can also be under here. Anong perception nila over a thing, over a topic. That's still descriptive design. So again, we are much into the purpose of the study. This is descriptive research. So what are the examples of descriptive research? We have case reports, yung mga case series reports, cross-sectional studies, yung mga surveys natin. Most likely they are descriptive researches, and yung mga ecological studies natin. Now, we have a scenario here, or a study here, which is an example of a descriptive research design. We have here a large population-based survey in Australia, and they actually determined what the community thinks of the factors that influence or should influence the spending on prescribed medicines by the government. So basically, we're talking here about the perception ng mga tao doon sa ginagawa ng government nila in terms of the spending of the finances to prescribe medicines. So at the end of the study, they will have a description. Ito yung perception nila, ito yung iniisip, ito yung pagtingin ng mga tao sa community, sa ginagawa ng government, sa mga factors na nag-i-influence sa government. Okay? So, ayun, na-provide natin yung hinihingi na description. So, again, it is called a descriptive research design. That is under classification based on study purpose. The next one is analytical design. Okay. Now, what is the purpose of doing an analytical research design? The purpose of this one is to identify risk factors, associated factors, mediating factors, basta factors. We are looking into factors class of why things happen this way. Lahat yon under siya sa analytical research design. Okay, yan yung purpose niya, why we are doing that study. Hahanapin natin yung risk factors. Okay, now we have two types of analytical research design. We have the case control and the cohort studies, which are actually observational studies. We will just do observation. We will not really do a lot of like experimentation or survey. Most likely this will be observation only. Now, let us classify the two, case control and our cohort studies. Let's get away with a lot of words in the slide. Let's look at this one, the screen, yung illustration class. This is for the case control study. Sa case control study, the study begins here. Please take note of this. At the present the study will begin at identifying the subjects of the study or our population, and then we will be grouping them into two. We will be grouping them into cases and then controls. That is why tinawag siyang case control study. Now, ano ibig sabihin ng case? For cases class, for the case group, it means this group of people are under one group because they share the same characteristic or yung outcome of interest meron sa kanila lahat. Like, we are going to study association of smoking sa lung cancer. So, the outcome of interest is lung cancer. So, lahat yung mga merong lung cancer, isang grupo sila under the case. And then the control, ito naman yung subjects without the outcome of interest. So, yun yung mga walang lung cancer. Yan yung example. Present time yan, ha? And then, what are we going to do with the case control studies? This is just actually like a retrospective study wherein we are going back to the past. Okay? Let's go back to the past and evaluate or measure if risk factors are present or absent sa kanila. Okay? So sa cases, lahat sila may lung cancer. Babalikan natin pa sa past. Example, 10 years backward. Let's see if itong smoking is present sa kanila or hindi. Okay? Ganon din yung gagawin natin sa mga controls. Let's go back to the past and check whether they smoke or not. So, pag present yung risk factor, check natin. And then absent kung wala. Tapos, i-check natin at the end, ilang percent yung merong ganitong risk factor. And then we will have a conclusion afterwards whether that risk factor is really a risk factor or is really associated with the outcome of interest. Okay, so again, this is called a case control study. So this is the illustration here. We have here the case, which are the group of people with the disease or the condition that we are studying. And then we have here the control. So these are the persons again, or the subjects with no disease. And then let's go back to the past and see whether they have past exposures to the risk factors that we are trying to investigate. Okay? Again, ang tawag dito, case control study. These are observational studies under analytical research design. Okay, another example here, the association between the use of traditional eye medicine and corneal ulcers. So, pwede itong cohort study pero let's focus on the case control study. So, anong gagawin dito? At present time, we will group the subjects into two. We have here the case and then we have here the control. So, for the case, those are the people with corneal ulcers. And then, ito naman yung mga walang corneal ulcers. And then, let's go back to the past. Whether they have exposure in this one, traditional eye medicines. So, if they have exposure, let's count, let's check how many percentage yung nagkaroon ng corneal ulcer para makagawa tayo ng conclusion na talagang associated itong paggamit ng substance na ito sa pagkakaroon ng sakit sa mata. Okay? Again, that's case control study. Okay? Questions? Or clarification? Wala. Wala. Sige, that is also true for the other example. Pero this is more on the use of drugs kasi most of the time, analytical research design is done by people in the medical field, especially doctors. If they're trying to study about like association of drugs and conditions or association of a certain factor to a certain condition also. So mostly sila yung gumagawa nito. Ito naman kasi, this is the case here. Pancreatic ductal adenocarcinoma. It's syempre a one type of a cancer. And this study aimed to see the association between the use of the aspirin and statin exclusive and combined to pancreatic ductal adenocarcinoma. So, babalikan pa rin yung past nito. At the present time, people will be identified whether they have that kind of the condition. They will be grouped into one. And then we will have another group of people here na control, na walang sakit. And then, babalikan yung past whether they are exposed to that certain drug medications identified. So, like it's, i-check kung factor ba siya para dyan sa cancer na yan. Okay? Again, ang tawag dyan ay case control study. The other one is called the cohort study. I don't know if you are into reading articles, journal articles, even published in the internet. Kasi doon natin ito mostly makikita. May mga makikita tayong studies na may nakalagay na this is a cohort study. Okay? So ano ba ibig sabihin yung cohort pag nabasa niyo siya? Si cohort, ganito pa rin. Our goal, our purpose is to look into the risk factors pa rin. Pero baliktad siya sa case control. Sa case control kasi naunang tingnan yung may sakit ba sila or walang sakit, tapos babalikan na lang yung past exposure nila for the risk factors. Si cohort, you have your population, start with the population, and then i-group natin sila. Ito, meron silang exposure sa risk factor. Ito, wala. Okay? And then we will follow them if magkakaroon ba sila ng outcome or hindi. Diba baliktad siya? Baliktad siya sa case control. Okay? Pero this one is a retrospective cohort, meaning we will look into the past. Example lang, cancer pa rin. So 10 years backward, itong mga subject na ito, yung nagsusmoke na for 10 years, ito wala. Hindi sila nagsusmoke. Siyempre, i-exclude natin yung may mga sakit na at 0 time. Tapos, we will look at the present, whether lung cancer is present or absent. So, baliktad siya. Risk factor muna before outcome. Okay? Pwede din namang prospective cohort. Medyo matagal nga lang ito kasi itong retrospective cohort, mag-e-end yung study mo at the present time. So, babalikan mo lang yung past. Ito, magsa-start ka talaga sa present. Example lang, cancer pa rin, no? Yung mga grupo ito ng mga nagsusmoke ngayon and then grupo ng hindi nagsusmoke. Hindi kasali yung may lung cancer na daan. Tapos we will follow them in the future kung sino sa kanila yung magkakaroon ng sakit at sino yung hindi. And then at the end of the study, we can conclude whether that risk factor is really associated to having the developing the disease or not. Okay. So another example here of a cohort study, we have here exposure to asbestos. So asbestos here is a risk factor. They are one group here. They are exposed. They have the risk factor. And then we have another group na hindi na-expose sa risk factor. And then we will follow them whether in the future they will develop mesothelioma. Okay, that's the name of the condition. Mesothelioma is a condition resembling pulmonary tuberculosis, wherein there will be scarring of tissues of the lungs, and they have the same signs and symptoms, yung uubo ka na merong blood. Okay? Pero that is again due to asbestos. So, yan yung cohort study na unang i-determine yung risk factor before yung disease. Okay? Wait lang plus na. Wait. 9:30 to 11:30. Okay. Sige. Any question before we'll move on to the third classification? Mag-ask na kayo. Wala pa kayong i-ask kay. Hindi mo ka-relate. Wala. Sige. So, next, let us classify research design according to the investigator orientation. Orientation ng investigator, kung ano ba yung field talaga ng investigator. Kasi most likely yun yung gagawin niya kung ano yung field niya. So we have here experimental design. So syempre kung ang field mo is like me na pharmacist, more on drug discovery. So most likely I will be doing a lot of experimental research. But what is experimental research? It is when we do research to produce an intervention for a certain problem. And if we want to establish cause and effect relationship. Okay? Cause and effect relationship yung tinitingnan natin for experimental research design. Na kung gagamitin ba natin ang isang bagay, magkukos ba siya ng effect? Okay? Yan yung experimental research design. Just like when you are going to evaluate a certain medication, whether it is effective or not for a certain disease. Cause and effect relationship yun. Na pag ginamit mo siya, bababa ba yung, itong example sa screen, bababa ba yung kanyang blood pressure. Okay? O kaya yung sa inyo sa medtech, example, antibacterial substance, pwede niyong i-check kung mag-cause ba siya ng either death or prevention of the growth of the microorganism. Okay? That's an experimental research design. So the design is like this. You have study begins here. You have your study sample. Depende yun sa pinag-aaralan nyo. You can use animals. You can use microorganisms in the laboratory. And we will be dividing them into groups also. The other group will receive the intervention and the other group may be the control. So sa school, para kasi through experimental research design talaga siya, aside from the intervention group, we have other two groups. We have two controls actually sa mga experimental research sa school natin. We have positive control group and we have negative control group. So sa positive control, yun yung binibigyan natin ng substance na talagang proven and tested na magkakaroon talaga ng outcome. Okay? And then meron din tayong negative control. Kagaya ng experimental research last year, they studied about the parang thrombolytic activity of a plant material. Syempre, their study sample there is the blood. The blood they have extracted from their participant. And then they divided the blood. The one group of the blood sample was treated with the plant material, that's the intervention, and then the other group of the blood sample receives the positive control. If I'm not mistaken, may gumamit no ng heparin. Tama ba? Heparin ata yun. And then the other group is just a control or a negative control. And then after that, after the intervention, we will be measuring the outcome. So nag-measure sila for the time of the formation of blood clot. Okay, yun yung ginawa nila. But please take note of the most important thing in an experimental research, and that is randomization. Okay, when you have your sample, diba, remember we are grouping them. And how do we distribute them in groups? You have to do randomization. Kasi without randomization, we cannot assure that walang bias. So magkakaroon tayo ng problems sa variation sa result ng ating experiment. Okay? Now we have the so-called quasi-experimental research design. This is actually the same with the experimental research design, but without the randomization. So if we are going to look at the illustration, we have the same here. You will still start with the population or the study sample, divide them into groups, and then check whether you will get the outcome or not. But what is absent here, again, is this one, non-random assignment. Okay? Pag hindi mo yan siya na-randomize, talagang hindi mo siya pwedeng tawaging true experimental research. Kagaya ng pag nag-animal testing kayo, class, baka meron kayong animal, no, itong animal na ito kasi gusto ko siya, doon ko siya ilagay sa group A. Doon yung ito hindi ko gusto yung mukha niya, so dito siya sa group B. Hindi yun siya randomization kasi ikaw yung pumili ng sino yung ilalagay mo. Okay? Pag randomization kasi, ano ibig sabihin ng randomization? Pag nag-randomization ka kasi, you are actually giving equal chance to all the member of the population to be selected in the study. Kasi pag sinabi mong ito lang yung gusto ko, yung gusto mo yun. Paano yung hindi mo gusto? Wala na silang chance to be selected or to be placed there in a certain group. So you have to give equal chance. How do we do that? In research class, when we do randomization, we can use like lottery method, bunot-bunot natin, lagay natin lahat. Pag fishbowl method tayo, na ilagay natin lahat ng names, for example, in a paper, and then bubunot-bunutin natin. Ito yung nasa group A, and then yung sa group B, pero they are actually having equal chance to be selected. That is what you call randomization. Okay? And then actually observational research design is still under is under classification based on investigator orientation. Kasi 'di ba yung observational design or the analytical design, nasama din siya kanina sa purpose, yung cohort and the case control study. Andito pa rin siya sa classification na ito. Kasi depende pa rin sa orientation of the researcher or the investigator. Kaya nga di ba nasabi ko kanina, most of the time, yung gumagawa ng research na ito is yung mga people in the medical field. Okay? Kaya yung mga examples kanina like association of this factor to that certain kind of the disease. So yun, orientation nila yun. Nandito pa rin siya sa classification na ito. But this is actually the same thing. Kasi cohort and case control study can be called analytical research designs or pwede din observational design. Okay? Sige. You can always ask question. You can send your questions sa chat or you can unmute your microphone if you want to clarify something. Baka may hindi akong na-discuss na maayos dyan or hindi nyo siya naintindihan para i-clarify natin siya at learn nyo itong different types of research. I believe not everyone will be in the research world someday, pero syempre you have your research now, so dapat nyo pa rin itong malaman. Okay? So number 4, this is the last classification. We have here classification based on research question or question orientation. Now, what am I talking about? The research question. I'm talking about the SOP, the statement of the problem. So, sa school natin, ito yung ginagamit natin class na research design. We don't really usually use the retrospective, the prospective, or even the observational studies. We classify our research design using this classification based on question orientation. And ito yun, ang under sa classification, the quali, quanti, and the mixed method design. Now, from our previous discussions, I have already discussed sa inyo what a quali and a quanti research is. When you say quali, again, this is data-free or hypothesis-free. We don't have numerical data here. We only have linguistic data. And we don't have hypothesis. So we are not really, in qualitative research, we don't really propose a solution to a certain problem. And therefore, we don't need to test anything. Okay? So kaya walang hypothesis. And at the same time, for qualitative research, we don't seek generalization. Most of the time, we do qualitative research because we want to explore a certain phenomenon, or we want to explore like experiences of people on that phenomenon. So remember, we cannot generalize, or just like sa historical research, when we want to study history, let's go back to the past, but we cannot generalize. Example, we are going to interview people na merong experience sa pangyayari na yon sa past. Example, like martial law na lang. So interview natin kung ano experience mo sa martial law. Ito yung sagot ng isa. Iba din yung sagot ng isa. So we cannot generalize. Okay? That's what we do, or what we mean by qualitative research design are researches that do not seek generalization. We take the answer of the respondents or the participants as it is, and hindi tayo magko-conclude at the end na ganito pala talaga during that time. Walang ganon for qualitative research. Okay? Now, the data that are collected are from non-probability sample. Now, I am assuming you are done with your statistics. Kasi sa statistics, ito pinag-aaralan. Yung probability sampling and yung non-probability sampling. So, anong ibig sabihin yan? Pag probability sampling, di ba pag nag-interview tayo or pag nagbigay tayo ng survey questionnaire, we don't really do that to all the members of the population. Example, lahat ng medtech, hindi ka mahuman kung sila tanan imuhang interview ko. Daghan kitang medtech sa world. So, di ta kahuman ana. So, ang atong ginahimo, we do sampling. Samples class are representative taken from our population. Now, how are we going to select them? We can do probability sampling or non-probability. Pag probability, ito yung sinabi ko kanina na may randomization. We give equal chance to all member of the population to be selected in our study. So, randomization yun siya. Like, pwede natin silang piliin through lottery method, pwede din fishbowl method, basta merong randomization. And then, ang non-probability, itong yung walang equal chance. So most of the time, for qualitative research design, non-probability siya. Hindi natin like binibigyan talaga ng equal chance lahat ng members of the population to be selected in the study. Ano lang, example, pag nag-interview tayo, gusto ko mag-interview ma'am ng mga medtech working in the hospital. Minsan nagko-convenient sampling tayo na kung sino lang yung nandoon, punta tayo ng hospital. And kung sino yung naka-duty, yun lang yung mai-interview natin. So wala nang equal chance. Yung mga hindi naka-duty, hindi na natin sila mai-interview. So yun yung ibig sabihin ng non-probability sampling. Okay? O kaya, minsan mag-interview tayo, si ano lang kasi kilala ko siya. Medtech siya, tapos kilala ko siya. So meaning nun, wala nang equal chance yung mga ibang medtech na hindi mo kakilala. Okay? Yan yung sinasabing non-probability sampling. So what are the examples of the specific study designs under the qualitative research? We have here the narrative, phenomenological, case study, and ethnographic. Let's discuss them one by one. Pero daan na lang natin siya quickly kasi diniscuss ko na ito sa inyo last time sa prelim. Let me check the time. Baka magsobra kasi ako sa time. Okay. No, pag sinabing ethnographic class, we are talking about studying the culture, the tradition, the customs of a certain group of people or organization. And most of the time we study like tribes here, native people, and then let's study their traditions, like how they do things, like how they, example, diagnose a certain disease or how they treat that certain disease. So we are going to observe them, or we can even conduct like interviews sa kanila on how they do things, class. And we are going to write that in our paper. So definitely we don't have a numerical data there kasi we cannot quantify their culture and their tradition. Okay? Hindi ko nang basahin yan lahat ha kasi I don't like reading the slides actually. Let's just simplify things. Now, when you say phenomenological research, class, pag narinig nyo itong research design na ito, please associate it directly to experience. So like, if we want to study the experience of a person, ito yon, phenomenological. Marami tayo nito sa school. Like a phenomenological study about the experiences of medical technologies working in a private laboratory. Meron na tayo yan last time. So nag-interview sila ng mga medtech. Anong tawag nun? Standalone laboratory. Nakalimutan ko yung tawag. Yung mga standalone laboratory or diagnostic lab natin. So nag-interview sila doon sa mga medtech working on that kind of like laboratory. So experience yun. That's phenomenological research. Pero meron din namang study last time na lived experiences ng mga medtech working during pandemic. So, pagbasahin natin ng laman ng paper nila, they are actually talking about the experiences. So again, automatic yan ha. Pag phenomenological research design, we are talking about experiences. So definitely this is hypothesis free kasi ano bang ilagay mo na hypothesis sa experience? Wala naman, diba? Okay, and then case studies also, but most likely case studies are done by example mga med pa rin na yung mga doctors natin, like they are doing case studies. Actually magkakaroon sila ng in-depth investigation of a certain disease, and then pagtutuunan talaga yan nila ng pansin. So they will observe anong mangyayari, what are the signs and symptoms and everything about that kind of case. And then isusulat nila yan. Okay? Again, that's still under the qualitative research design. And then for the narrative, ito yung magna-narrate lang tayo kung ano yung sinabi ng ating participant. So for example, for historical researches, dito yun siya malalagay, wherein we are going to narrate what happened in the past chronologically. Okay? So pasunod yun for the events that took place sa past. That's a narrative research design. Okay? So all of this class are under the qualitative research design. I just don't know, I cannot remember whether may nagpasa sa inyo ng quali doon sa concept paper. Okay. Questions before we'll move on to quantitative research kasi ito medyo marami. Okay? Wait lang. Wait lang ha. Walay. Wala na, no? Sige. So, let's move on to quantitative research design. Again, quantitative research design. This time, yes, we have numerical data. Nakita niyo sa screen, necessarily numeric ito. And our numerical data are actually empirical, meaning these are products of direct observation or direct investigation. Like we are really doing the experiment personally, or we are doing the investigation, or like even the survey, tayo mismo yung gumagawa. So we have generally empirical derived from direct data. And this is the time that we make inferences, we make conclusions, projections, or generalizations. Whether we do experiments or we do surveys, at the end of our research, we can really have a generalization. Like, maka-generalize tayo na ang isang plant material is effective or not, or pwede ding maka-generalize tayo kung nag-conduct tayo ng survey, example, level of knowledge of the medtech students, maka-generalize tayo at the end whether they have a high level of knowledge or a low level of knowledge. Okay? So we only have two. We have descriptive and experimental, pero actually, even if we only have two, marami tayong i-discuss sa dalawang yan. Okay? Yan yung common sa atin sa school. Marami tayong descriptive and experimental research. Okay? So, let's discuss first the types of descriptive researches. I have mentioned what descriptive research is a while ago. Yun yung ang ating purpose is to give description sa ating respondent or sa behavior nila or sa characteristic nila. Pero ito yung mga types. We can do surveys class for our descriptive research, either a descriptive survey or a descriptive normative survey. So pag descriptive survey, yung ating questionnaire is like tayo ang gumawa. Okay? Tayo ang gumawa. Tapos pina-answeran natin sa ating mga respondents. Kasi pag descriptive normative survey, gagamit tayo ng questionnaire class that is like already accepted and meron ng parang validity, valid na siya and at the same time reliable. Kagaya ng mga test na ginagamit ng mga psychologists, like if they want to test whether the person has depression or not, 'di ba? Parang yung test nila is ang tawag dyan. Nakalimutan ko, may certain tawag dyan na yung test na yun is yun na talaga yung test na ginagamit na para makakonclude ka whether the person has depression or wala. Okay? So most of the time, we are actually doing descriptive survey in the community. Like we are going to make our own questionnaire and have them answer questions there. So ano yung mga examples ng surveys that we can do under the descriptive research? We have, for example, this one. Palitan lang natin ha. Kasi I'm using the same slide for all the programs kasi. So stress and coping strategies of medtechs in the hospital. Survey yun siya. And descriptive kasi at the end of the research, we can conclude kung ano na ba yung stress level ng mga medtech working in the hospital and how do they cope up with their stresses. Okay? And then example, yung mga studies about job satisfaction, survey pa rin yun. No? At the end of the research, we can describe whether they are really like satisfied with their job or hindi. Okay? Yung mga productivities of employees, yung effectiveness ng mga manggagawa in an organization, kasali yan siya dyan. Yung CAP, knowledge, attitude, and practices nila sa isang bagay, kasali dyan sa survey. Yung sa mga students, stress ninyo, coping strategies ninyo, yung academic performance ninyo, and then yung parang preparation ninyo for the board exam, ganon, survey pa rin yun, descriptive. Okay? Pero we have numerical data here, right? Pwede kang gumawa ng questionnaire ninyo. Tapos, merong like yung 1, 2, 3, 4, 5. I believe lahat tayo nakapag-answer ng ganyang klaseng survey. So, di ba, merong numbers doon. So, merong numerical data. Okay? Now, aside from surveys, we can also do developmental studies. Okay? So, sa developmental studies naman, from the name itself, we are going to like devote a certain period of our life or our time sa ating participants, and we are going to study them, their development. Okay? It might be sa skills nila, skill development nila, or sa knowledge, whatever, basta as long as we are talking about their development. So since we are talking about development, it takes time. So if you have all the time in the world to do this, then you can always do it. But we have two methods in doing the developmental studies class. We have longitudinal and cross-sectional. Again, longitudinal and cross-sectional. Now, anong pagkaiba ng dalawang methods ng developmental study na ito? Sa longitudinal class, you will have the same set of participants and then you will follow them para makita mo talaga yung development nila. So, parang hindi ata natin ito magawa for an undergraduate research kasi nga, hindi tayo makakagraduate nito kasi titingnan pa natin sa future kung ano yung magiging development nila. So kung titingnan natin yung mga examples, di ba, parang mahirap talaga. A study on the mathematical concepts that high school students develop from first year to fourth year. So meaning nun, ang participants natin yung mga first year ngayon. Titingnan natin yung like yung mga mathematical concepts they have learned sa kanilang first year. Tapos susundan natin sila, mag second year sila, mag third year, and then mag fourth year, and then titingnan natin kung ano yung mathematical concepts na na-learn nila. So imagine we will be devoting 4 years of our time, of our life for that. That's longitudinal method. For the ang tawag dito, we have developmental study. That is also true, like this one, a study on radiologic technologies in the hospital laboratory for the first 5 years of service. Yan. Imagine from the first year, susundan mo sila hanggang 5th year nila sa service nila, kung ano na ba yung mga skills na natutunan nila while working. O kaya yung study on autistic children from 1 to 5 years old. Mahirap yun. 5 years talagang mag-observe ka dun sa mga bata. Okay, for their development. This is the first method, longitudinal. The other one is called cross-sectional method. Now, sa cross-sectional method, pwedeng hindi magkapareho yung ating participants, but we can still see the development. Example, hiwalayin natin, meron tayong one group of participant, example, ito yung mga first year medtech. I-check natin yung kanilang skills. Okay? Tapos, meron tayong another group here. Ito naman yung mga fourth year. So, hindi na natin hihintayin yung mga first year na mag-fourth year, ha? Meron tayong group na first year, meron din tayong group na fourth year. Magkaibang tao yan sila. And then, we will just have a comparison of the skills nila to check the development. Again, we call it cross-sectional. So, we will study them at the same time. Okay? Pero magkaiba yung kanilang example age. Ayan. Ano ito, ha? Under ito sa developmental study. So this is still under the descriptive researches. Okay, questions or clarifications? Anyone na may gustong i-ask? Wala? Sure na yun. So how about class D? Assessment or evaluation. From the name itself, assessment or evaluation, we are going to study the efficiency or the efficacy of something. Okay, let's check examples here. Example, the use of scanners in determining sex of babies. We are going to evaluate that machine, whether it is like 100% effective in really determining the sex of the babies. Hindi ba siya nagkakamali? Or meron ba siyang how many percent na error? Okay, so may numerical data pa rin tayo dyan. O kaya, capabilities of freshman students entrance in College of Nursing. So, i-evaluate natin sila before sila papasok as student here in the institution. So, even like you, di ba, you were evaluated. Like you have your entrance exam here sa doctors and you are evaluated of your like capabilities ninyo. Diba may mga hindi tinanggap yung hindi umabot ng anong stay 9 yon. Okay? And then performance of graduates in your radiologic technology licensure examination and the factors that influence it. Okay? So, ayun, assessment pa rin yan. Mataas ba yung passing rate? I mean, example, yung scores nila sa board exam, yung rating nila, i-check yun. And i-check kung what are the factors that influence it. That's assessment or evaluation studies. Okay? Now, for comparative naman, ito yung kung titingnan natin yung kanilang SOP, meron silang question na is there a significant difference? Sample, is there a significant difference in the skills of the female and the male medical technologists in the hospital? That's comparative. We are comparing two variables. Okay, sa mga babae at sa mga lalaki. So again, tingnan nyo yung SOP. Kung ang SOP ay nagtatanong ng is there a significant difference, ang kanyang research design ay tinatawag na quantitative, descriptive, comparative research design. Okay? Pero pag ang tanong class is this one, is there a significant relationship? Ayan. Pag yan yung hinahanap, relationship or association, we call that quantitative, descriptive, correlational research design. Okay, relationship ang hinahanap. Like this one, relationship daw between management styles and leadership dimension. Meron bang relationship daw yung management style ng isang person doon sa leadership dimension niya? O kaya role of personality factors on stress experienced by the pharmacist working in the community. Kung ganito ba yung kanyang personality, does it mean madali siyang ma-stress or hindi siya madaling ma-stress? Ganun yun, relationship. Pag relationship ang hinahanap natin kung like directly proportional ba siya or inversely proportional. Yan yung hinahanap natin kapag correlational lang ating study. When you say directly proportional, pag tumaas yung value ng isa, syempre tataas din yung value ng isang variable. Syempre kung inversely, pag tumaas ang isa, bababa yung isa. Like example, maturity. Does maturity comes with age? What does it mean? Pag mataas yung age, mataas din yung maturity or the other way around? Yan yung hinahanap for a correlational study. Okay? And lastly, we have here follow-up studies or like yung mga tracer studies na hinahanap. From the name itself, follow-up studies, ginagawa natin to if we want to like follow up something. Example, may marami tayong tracer studies sa school class. Tapos yung mga tracer studies, hinahanap natin yung mga graduates. Example, graduates from 2019 to 2021. Hanapin natin sila and then magpa-follow up tayo sa kanila. Kung nakapasa na ba sila ng board exam. Nagpe-trace tayo kung saan na sila. Nakapasa na ba sila ng board exam? Nakatrabaho na ba sila? Saan ba sila nagtatrabaho? Medtech related pa rin ba yung trabaho nila? Okay, that's a tracer study and it's one type of a descriptive research. Okay, so dyan, yan yung pagpipilian nyo kung gagawa kayo ng descriptive research. Before tayo class mag-break lang muna tayo sandali, tapos we will continue after hanggang 12:30 yung klase natin, di ba? Yun yung time na mag-ano pa. Check ko muna ha, baka hindi na kayo magsabay sa ibang section. Tapos pasok next week. Baka mauna ako sa inyo. I want you kasi nasabay lahat. Kasi Wednesday. Wait, class. Let me check. Sige, dito na lang muna ako mag-end. Tapos mag-study kayo ha, kasi we will just have a quiz on Monday about all the things I discussed this morning. So, yun yung ating gagawin. Pero let me give you first an example of how they wrote their research design. Para pag kayo na ang gumawa, this is the same study I was showing you last time, yung mga previous meetings natin, yung medical fake news. Diba pinakita ko ito sa inyo, yung kanilang introduction and all parts of the introduction, even their RRL, pinakita ko sa inyo. Now, to have a continuity, continuation, let's look at their methodology. Okay. Ayan, nasira lang ito ha. Nasira lang siya, class. Yung kanyang pero next page na dapat ito, next page. So the section is entitled Methodology, and then you provide a very little introduction of what is the content of the methodology section, and then again you start with the research design. So paano nila sinulat yung research design nila? They have identified what research design they use. First, they have here quantitative daw yung research nila. So they discussed class what a quantitative research is. And then after that, they specified it. Okay, I have highlighted that ha. Descriptive research design, specifically correlational. Ito daw yung research design ng study na ito. Quantitative, descriptive, and then specific is correlational. Bakit kaya? Let's go back to their SOP. We go back to their SOP. Yes, they have a question here. Is there a relationship between medical fake news and fear-mongering during COVID-19 pandemic and vaccine confidence among the millennials in General Santos? Okay, so correct yung kanilang research design. Sa ano class? Sa defense, yan yung isa sa unang ina-ask ng mga panelists. What is the research design of your paper or your study? You have to be familiar with that. Pag meron na kayong papel, hindi pa natin yan masasagot ngayon nang wala pa kayong papel. Okay? Do you have questions? Again, mag-quiz tayo on Monday. Tapos, maybe I will continue with the remaining topic. End muna ako ngayon kasi I need you to balance natin with the other section.